My name is Niyati, and I'm currently serving in Philadelphia at Family Practice and Counseling Network as a prenatal patient advocate across 3 clinics in the city. This role has been incredibly gratifying for so many reasons and has deepened my knowledge of what public health looks like in practice and broadened my skill set in community engagement and patient care. In my role, I work alongside the clinical care team and patients to directly support their resource needs beyond medical care. This looks like a lot of different things. I'm often helping people apply for health insurance or financial assistance, SNAP benefits, and subsidized childcare, or finding city-based programs that can connect patients to everything from no-cost cribs and car seats to immigration support and parenting education. As a bridge between patients and their clinical care team, both patients and providers can reach out to me to put different needs or concerns on my radar, and then I work to assist them however I can. The experience of engaging with patients directly and building meaningful relationships with people across the city has given me insight into the complex and compounded barriers people must overcome in order to access the quality care they deserve. While I learned about the social determinants of health abstractly in college, learning from people's lived experience has illuminated gaps in healthcare that I hope to support as a public health professional. Also, living in Philly has shown me that I see myself staying here for a while after my service term. And since I've gotten more acquainted with the scope of resources available to people here, I feel better equipped to contribute to public health policy and programs based in the city. For example, noticing food insecurity prevalent within the communities I support, despite access to WIC or SNAP, showed me that supplemental benefits were not enough. So, with the knowledge of local organizations in the area, I connected our clinic to the Food Trust, which has a program that provides Food Bucks RX to people. This way, providers can prescribe coupons to people to afford fruits and vegetables and help increase nutrition security alongside WIC and SNAP. One special aspect of this year is how serendipitously this position has connected to my interests and care work. My academic interest in college was maternal and reproductive health. I wrote my thesis on the history of midwifery and doulas in the United States, and inspired by that research, I trained to become a doula the summer I graduated. Coincidentally, this was right before starting my service term. Now, through my position, I've learned so much more about childbirth and lactation support and the emotional and physical needs of parents navigating their pregnancies. With opportunities to build deep trust and connection with the patients I support, I've been able to assist patients from our clinic during labor, and this has been so fulfilling. Being by people's side throughout the course of their pregnancies and witnessing them become parents has shaped how I hope my journey after NHC will go. Now I'm looking towards careers that would allow me to engage frequently in patient care while also being part of a task force or policy group that spearheads upstream level changes. Seeing the midwives and providers at my clinic contribute to community clinics while also advocating for birth justice at a citywide level has shown me the possibilities of combining public health with individual caregiving. All in all, this experience through NHC has taught me more than I could have imagined. I feel that I've become a better advocate for myself and for others. I've learned about how to center empathy and care work in the work that I do, and I've developed stronger skills in communication. I've grown more confident in the knowledge and support I can offer as a doula, and I feel that I know more of the ins and outs of public health landscape in Philadelphia. I'm really grateful and appreciative for this program, and I'm very sad to think about leaving so soon, but I'm excited for what will come next. Thank you.